Family and team of doctors at MU Healthcare in Columbia are calling the recovery of a 3-year-old boy the best Christmas present ever. The young boy had COVID-19, which then caused a stroke.
Our Missouri Capitol reporter Emily Manley spoke with the family and the team of doctors.
Behind me in the MU Women's and Children's Hospital, there's a 3-year-old boy named Colt who is recovering from COVID-19, which caused him to have a stroke. That stroke made Colt lose his ability to use his right arm and leg and his speech.
We thought we were going to lose him for sure, but it's very hard. I don't care how tough you are, you will cry. You can't help it when it's your 3-year-old laying there.
It's something no parent ever wants to go through.
His behavior was quite different, and the pain that your child is in is I can't even put into words. You couldn't even touch him and not know that it wasn't hurting him.
For more than a week, Tim and Sarah Paris have been inside MU Women's and Children's Hospital as their 3-year-old son Colt lies in a hospital bed.
Just trying to explain to him why I'm holding him down, why nurses are trying to stick needles in his feet.
Colt stopped eating and drinking. His mom took him to a local clinic near their hometown of Salisbury, where he tested negative for COVID. The clinic recommended they come here.
They did get a test back by the time we were admitted, and that's when we got the positive antibody to know that it was COVID.
Hours later, Sarah started to notice something different about her son.
He didn't use his dominant arm to grab it. He reached over to grab his bunny.
She says Colt also couldn't speak. After running tests, doctors said he had a blockage in his brain.
Result came back, I looked at it, and there was a clear stroke. Okay, so lack of blood supply, in his case, to the left side of the brain.
MU Healthcare pediatric neurologist Dr. Paul CARNEY diagnosed Colt.
What was different here was a child. And as I mentioned, there really is no other case like this.
Hours later, neurologist Dr. Camilo Gomez removed the clot from Colt's brain.
We think that the reason these patients with COVID, including this child, have strokes and a variety of other problems is that they have a propensity to form clots.
CARNEY says through his research, there has been one other case like this, and the child didn't survive.
If you notice your child has COVID and they're having problems walking or problems talking, don't just chalk it up on they have fever. It could be a nervous system problem.
Colt's parents hope their story will make others aware of COVID-19.
Masks and stuff like that, people need to wear them. It's important if you don't want your children to go through this.
Now this goofy, silly, and energetic boy is on the road to recovery.
Like you said, we've already had our Christmas. It's sitting on the bed there in the room. I don't think we could have asked for anything more than that.
Now Colt is expected to make a full recovery, but doctors say he is going to remain here at the hospital for about the next week as he goes through rehab for his right arm and leg and also his speech. Reporting for our Missouri Capitol Bureau in Columbia, I'm Emily Manley.